March is Colorectal Cancer Awareness Month. It is a time to highlight the importance of early detection and prevention. Joining us today to share valuable information and insights on this crucial topic is Justina Adongai from Omni Family Health. Welcome back, Justina.
It's good to be here.
Oh, it's great to have you. Looking sharp as usual.
You as well. You look great.
Okay, so this is a very important topic, I think, because this is, I think you mentioned one of the second deadliest cancers that we have. So tell us about Colorectal Cancer Awareness Month and why we should be highlighting it.
So Colorectal Cancer Awareness Month is the month of March, like you already said. This was started like in 2000, and this day was coined by President Clinton to raise awareness, education, provide information to the general public about colorectal cancer and how this can be prevented, or the screenings that can be done to prevent this cancer. Like you said, it's the second deadliest. It continues to cause a lot of problems. A lot of research are being done on it, but education and awareness is definitely important.
Is this form of cancer curable?
So depending on when it's caught, and that's why screening is so important. When it's caught early, intervention can be done. So surgeries, chemotherapy, and procedures like that. And with that, we have some cure. However, a lot of times it's caught at a late stage because, again, screenings are not done, and people, just get sick for a very long time without even know what's going on.
What are the type of screenings that can be done to try to detect it early?
So we have a stool-based and a visual testing. So the stool-based can be done at the comfort of the home, which a lot of my Hispanic patients and a lot of patients do like, because they can just take the kit home, do it at home. And we have the visual testing, which is the colonoscopy, where you have to see a GI doctor to do the procedure. That is the gold standard, however. So we have to provide education that even if you do the stool-based testing, if it does come back positive, you still have to do the colonoscopy to see what is going on, and so intervention can be done.
What are some of the symptoms or signs that somebody should be looking for that would trigger them to say, maybe I need that screening to look and see if anything's going on?
A lot of the symptoms can be very vague because they can coincide with other GI conditions. So for example, people that have like Crohn's or ulcerative colitis, they might think those are symptoms from their disease, whereas it's, colorectal cancer. So things that we see are abnormal or inconsistent stools. So sometimes you can be having diarrhea, sometimes you can be having constipation, your stool can be narrowed, lots of fatigue or just tiredness, loss of weight without really trying to lose weight, blood in the stools, lots of abdominal pain and cramping. Those are some of the symptoms that we kind of see when it comes to colorectal cancer.
Is this something that if I do like the first test and it comes back clear, should I keep testing? How often should I be screening myself? So
with the stool-based testing, the FIT test, you get screened every year if it's negative. The Cologuard, you get screened every 3 years. Now the colonoscopy, that is screening every 10 years. Now there's even more research coming on with the colonoscopy saying that people can wait more than 10 years to get screened because it takes that long sometimes for these cancers to build. So just depending on what test it is, the times vary as well.
Is there any type of lifestyle changes that we can make to help prevent this from forming in the first place?
Absolutely. Lifestyle is always big, always key. We cannot overemphasize on that. Now, staying active, we always talk about, just get moving, staying active however you can, because obesity is a big risk factor when it comes to colorectal cancer as well. So we want to stay in a healthy weight. What we eat, that is huge, very important.
Eating enough fiber.
Fiber is great, staying hydrated, your plant-based products as much as possible. We want to cut down on those red meats. So the beef, the pork, the lamb.
All the tasty ones.
Yes, I know. And the processed meats, the hot dogs, the salami, that even starts from childhood. Parents, we feed our kids hot dogs and all of that. Their lunch boxes are filled with processed meats. And it starts that way because as you would know, younger people are getting colorectal cancer and they're still researching on why, but
Yeah.
it could also be from the things that we're eating and stuff. So those are important. Adequate quality sleep, stress reduction, very important. Alcohol and cigarette smoking. Those are huge. We need to cut down on that, stop that as much as possible. You know, very, very important. And just social connection. You know, it's shown the social connection has shown to increase longevity, and they've emphasized this over and over now. So those are just a few things that we can just do every day to reduce our risk.
So if somebody at home thinks they need to speak to someone or they have more questions, how can they reach out?
Well, at Omni, we have a whole lot of different clinics around 4 counties. They can call our number as on the screen. They can text those numbers to get in touch. They can stop in any of our clinics to make an appointment or do a walk-in appointment. But education is key. Know your options. Know what you can do to prevent yourself from developing colorectal cancer.
Well, thank you so much, Justina. It was great to have you today.
It's great to be here. Thank you.
And we'll be back with more Studio 17.